Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned local hospital right here in Kingman that provides health care for you. This show focuses on healthcare issues that might be relevant to either you or your family members or friends that you know. So I hope you'll stick around. I've got a great guest on the show today, and we've got a really exciting program. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Tricia McNeil from the KRMC Pediatric Therapy Center. Thanks for being on the show today, Trish.
Sure, no problem.
So, tell me first about yourself. How long have you been in Kingman?
I've been here almost 2.5 years now.
Oh, okay. Now, did you come to Kingman for KRMC to work here?
Yep, pretty much.
Okay.
Part of the reason we have family who moved here as well.
Oh, okay.
And so it was kind of worked out that we looked all around the area, and this was the best place for me to be.
Super,
Yeah.
super.
Yeah.
So, is there parents that came? Or?
Yep.
Okay.
My parents live here in Kingman now, and my in-laws live in Las Vegas. So
Oh, well, that's nice.
kind
Have
of
family
centralized. Yeah,
very
it is
close.
nice.
That's
yeah,
good.
we were far from family for a lot of years,
Well,
so it's
I
nice
know
to be
how that
close.
is. Been there myself, so I
Yeah.
definitely know how that is.
Yeah.
So, how did you get into pediatric therapy? So, you've obviously there's some special education.
Yeah,
go
well,
through.
I've been interested in pediatric therapy since I was a little girl.
Oh.
You know, in Girl Scouts, we had to decide what are you going to be when you grow up, and that was
Uh-huh.
something I always wanted to work with kids with disabilities. And in high school, ended up working in a physical therapy clinic as a tech, and fell in love with it. And we were in a rural town, so we saw everything from kids to people with neurological disorders to orthopedic issues. And of course, I veered towards the
Right.
kids part of it. So that was my course from there on. Went to undergraduate part of the time at the University of Wyoming, and then I finished up. We moved to Michigan, and I went to Oakland University in Rochester, Michigan, and that's where I ended up going to grad school in physical therapy program. It's now a doctorate degree program. So it was a 3.5-year program, and
So you have 8
got
years?
my doctorate. Just about 7.5
Wow.
to 8 years. Yeah.
That's a lot of school.
It is. It is. Yeah.
So, home is Wyoming? What
Nope. Home's kind of
around?
a couple
Okay.
places.
Okay.
I was born and raised in Northern California,
Oh, okay.
in the foothills near the Sierra Nevadas.
Yes.
And then I went to high school in Northern Nevada, Winnemucca, Nevada. And
Oh,
so,
okay.
So those areas are home in
Yeah.
between Sacramento and Winnemucca, Nevada.
Oh, very good. I think I have a Mustang that's from that area.
Very well could be. Yep. So, but now we call this home because family's close by here.
Sure.
You know, we love the West Coast. We love the desert.
Very
So,
good.
yeah,
That's
there
good.
we are.
And so you're married?
I am.
Do you have children?
No children
Not
yet.
yet.
Yep,
Okay.
hopefully
So is
soon.
your husband? Did you meet him before school or during school?
We went to high school together.
Oh,
so
very
we've kind of
good.
moved all over the country together.
And what does he do?
He's a fabricator. He builds race cars and street
Oh,
cars.
that's a good. There's lots of cars in Kingman, especially in
Yeah.
May when you come through with our Route 66 and going from Seligman. Have you been here for that yet?
I have not seen that. I think I've heard about it though.
Okay, yeah,
Yeah.
you'll have to watch for it. They come through from Seligman because, of course, we're the longest stretch of Route 66.
Right.
And so they come through from there.
Uh-huh.
So when we're talking about you came to Kingman, and did we have a pediatric therapy department at that point?
Unofficially,
Okay.
we had the hospital treated kids with
Special
disabilities
needs,
and
okay.
special needs,
Uh-huh.
yeah. But we didn't have our own department. And
Okay.
so over the last couple years, it was probably maybe 25 to 30% of my caseload when I first started on, kind of fluctuated up and down from
Okay.
there. And then over these last 2 years, we've really grown the program, and now I have a full caseload of
Wow.
kids, and we opened our pediatric center and everything.
Right,
So
and
it's
that's here in
been-
the wellness center,
in the
medical
medical,
professional
yes,
center, because
yes.
you're on the second floor,
we're on
right?
the second floor,
Okay,
yeah.
so-
We used to treat the kids
Okay.
down here in the wellness center.
Okay, but now you have your own
We
separate
do.
area. So if someone was coming, they'd take the elevators from the medical professional main lobby up to the second
Yep.
floor now.
Yep.
Okay,
And we're
very
the second
good.
door on the left.
Very good, okay. So now the types of children that you see, we talked about that have special needs, and programs like that. And what kind of therapies do you do with them?
Well, it's a huge variety. We have 3 different therapists. We have physical therapy, which is what I do, occupational therapy, and speech therapy with a speech language pathologist. And we all, specialize in pediatrics.
Okay.
And so, for physical therapy, we have kids who may have cerebral palsy or Down syndrome. We treat a lot of kids with autism. I even treat babies who have like torticollis, which is where the neck is tight and kind of crooked.
I haven't heard of that one before.
Sometimes with that, they'll have a flattened skull too. And so we work on different positioning and strengthening, stretching, different things like that to make sure they're progressing right. Sometimes
so you see all ages then?
Oh yeah, zero up to whatever. yeah.
So like once they turn 18, then they progress to adult?
Yeah,
therapy?
Somewhat, and I even see some of the adults over 18 who, because I have experience with working with kids with autism or whatnot, sometimes it's easier for them to stay on my caseload than go to a therapist who hasn't had that experience.
Sure, that makes sense. That makes sense. And then you sit now occupational therapy. What is that type of
occupational
program?
therapy? They work with kids on different sensory needs, like kids with autism sometimes have different sensory things that are going on, deficits or whatnot. Maybe they won't eat certain types of food. They'll only eat chicken nuggets, or I don't know, but they'll help with those kinds of textures, in the mouth, or maybe they won't be able to walk barefooted, or maybe they don't want their shoes on. They'll help them with, different sensory aspects, and of course that's not my specialty. But they also do a lot with everyday care, so getting dressed, being able to grab a fork or utensil, and bring it to the mouth. Work on handwriting, fine motor skills, grasping things and different things like that.
And then the speech, obviously, they're helping them learning to talk or
helping them with talk and being able to pronunciate better. Speech and OT both work with different eating things too.
Swallowing.
The speech therapist works more on the swallowing piece of things, where the occupational therapist works more on maybe the oral motor task or getting it to the mouth.
So. Now, for something like that, so if a parent has a child that they feel has, some special needs or has some problems, do they go to their doctor for referral? How do they get into your program?
Typically, it starts with the doctor, and they'll get a prescription from the doctor for one or multiple of the therapies, and then the doctor will, send the script over to us, and we'll get them in, depending on the insurance and whatnot, what has to be done through there.
So insurance usually covers or should cover a lot
typically,
of it, right?
Yeah. And then the state also, a lot of our kids are on state insurance that works with kids specifically with developmental disabilities. And so through them, a lot of them will, we do need the prescription from the doctor, but we also get them directly from their like case manager through the state.
That helps them through that. Well, that's good to know. So, I mean, of course, you always hope that you're going to have a 100% healthy child, but that doesn't happen for everyone. And so it's good to know that there's programs like that can help them. Well, I've seen pictures. I haven't, to be honest with you, I haven't been upstairs. I'm going to have to do that and see. I've heard just wonderful things and seen pictures of it, and some of the equipment you have there seems kind of unique and different too. There's one that was like a swing, it looked like.
Yeah, we have a whole swing system, several different attachments to the ceiling that we have a bolster swing, which is probably the one you saw, that's like a big round log that hangs on 2 sides. We have net swings and platform swings and tire swings and different vines we can hang up. And with those different things, we'll work on strengthening by being able to hold on to, say, that log bolster type swing. Or some kids, and again, this is a little more on the occupational therapy side, if they have difficulty tolerating movement, sometimes those swings help to get them to accommodate to that and help their vestibular system.
So it's I was just going to say, is it kind of almost a balance issue sometimes, like where they get dizzy from the movement?
Somewhat. In the inner ear is where we get kind of our balance and vestibular system part of it from. And so it can help to make that system work better, because sometimes it's has deficits to it.
Sure.
A lot of our kids, because they aren't moving as well as a typically developing child, they will lack, you see a 2-year-old, a typically developing 2-year-old, and they're flipping and jumping and spinning and falling down, and a child who maybe is in a wheelchair isn't getting those same experiences, so their vestibular system isn't developing the same way.
Oh, okay.
So
That
we
makes
use those
sense
different
then.
swings to provide those kinds of
Motions and sensors.
experiences. Yeah.
Okay. So do you work then with other doctors? We're talking inner ears. So do you work with the ENT at all?
No, not really. We
Okay.
don't. No, we probably the closest people we work with are orthotists who help with different bracing systems.
Oh, okay.
And making custom braces for the kids, or in the case of the babies who have the flattened head, we'll get them in touch with an orthotist because they can put on a helmet, a cranial remolding helmet is what it's called, to help to shape the head as they're
catch
growing.
that when they're young,
Yeah.
so that it can, when it's still moldable.
Yep,
Right.
exactly.
Forming,
So that's probably the number one person that we work with hand in hand, besides each other.
Sure,
We're
right,
always
right.
bouncing ideas off of each other. But then, of course, the pediatrician, we work
Okay.
with them in case, because we see the kids every week. So sometimes
Okay.
we see things that, in one visit to the doctor, it may not
Be
show
as
up.
apparent, right?
So, we'll let the doctor know things that we're seeing, and if we
good.
feel that there's a referral that needs to be made, suggest it if appropriate.
Now, do we have orthotists, you called them, here in Kingman? I'm not familiar with
We
them.
do have an orthotist in Kingman. There's also some in like Havasu, and some
Okay.
of our kids go up to Las Vegas or down to Phoenix for them, or into
Okay.
Flagstaff.
Yeah.
There's a program
Well,
in
we can
Flagstaff.
talk a little bit more about that after the break. We're going to
Sure.
just take a quick break right now. Stick around. We'll be back right after these messages and learn a little bit more about what Tricia does. Welcome back to Your Health Matters. My guest today is Tricia McNeil. It's been great having you on the show, Tricia.
Yes, it's been a pleasure being here.
So we're talking more about the Pediatric Therapy Center here at KRMC and the different things you do. We talked about the swings, but I know you've also have talked about the balls. There's balance balls, or what are they?
Therapy balls. So
Therapy
we have
balls, okay.
very big balls in the various sizes.
Okay.
That we work on different strength things, working on core strength and helping kids. Maybe if a little one can't get themselves to sit up, we'll work on pushing up. Through the ball, and the kids love them.
So you're kind of using play to help them.
Yes, definitely.
Build at the same time.
Yeah, we're big on that. I feel we want therapy, of any kind of therapy, to be functional, of course. And for kids, their
Has to be
function
fun.
is play.
Yeah.
And if they don't think that they're having fun with it, then it's probably not going to stick.
Sure.
If they can't learn that they can, jump on the trampoline without doing X, Y, and Z, we got to get them doing it.
Okay.
right away. Yeah.
So do they go home do they get homework?
They do, yep. We work with the parents. We give lots of handouts for the
Okay.
parents to work on different things at home. 'Cause some of the kids will only see one time a week.
I was going to say, even once a week isn't going to be enough.
Right, 45 minutes or an
Right.
hour one time a week
Yeah.
isn't going to make huge changes, so we give them a lot of things to do at home.
Okay.
Sometimes it'll be fun yoga exercises, or things to work on a baby that every time, you give them a diaper change, make sure you're helping them sit themselves up or whatnot, a lot of education.
Doing things with the legs and arms and just always keeping them moving kind
Yep,
of thing.
making them do the things and not doing it for them. It's easy just to pick the child up
Sure.
when they can't do something, and so we really encourage the parents to encourage the child.
Sure, to help
so
them
they do it.
be as self-sufficient as possible,
Exactly,
probably.
Exactly, yeah.
That's good. So what other types of are there illnesses that can cause these kind of issues that the kids come in?
We see anything and everything. I mean, there's a
Okay.
lot of different chromosomal disorders that, a lot of kids that we see, they may be the only person that the doctors have ever seen this in, so a lot of very rare disorders. Sometimes our kids don't have any diagnosis yet, we know there's some kind of syndrome or something going on, but
It's not
nobody's
working
really
right, but-
found anything yet that's the actual cause
That's
of it.
frustrating from
And
a parent standpoint. I can't imagine
Yeah.
not having answers.
Yeah, and some of those things, it's if they're getting the services, at least they're
Sure.
progressing
Right.
and getting better that
Right.
way.
And then, like accidents, do you get anybody usually that's had any kind of...
Occasionally, we'll get a child who's had a brain injury or something like that. but we don't get a lot of kids who have like broken their arm or something.
Well,
you know,
that's what I was
kids are
wondering,
very resilient.
Right,
so
right.
they typically don't get or need therapy if
Okay.
they've done something
I was
like
just
that.
wondering because I know sometimes like if a little one breaks a leg type of thing and they're in a cast for 6 weeks to a couple of months, sometimes that leg can really atrophy.
Right.
And so then maybe they need some help. So
And
not too
typically
much.
we don't because
Okay.
kids are, again, they bounce back so fast. I
Sure,
mean, they're very
that's
motivated
true.
to get
It's
back
more
on the
us
playground.
adults that
and
have the
it's true, yeah. So we don't see a lot of kids with those
Okay.
kinds of things, but with neurological deficits, you know, like I said,
Yeah.
with a brain injury or,
Okay.
you know, something like that.
Yeah, okay.
We'll see.
So what are there other things like in the I know that speech and occupational aren't your specialties, but are there things that you can think of there that are kind of unique for KRMC or
In regards to speech and OT
or in you too, maybe the things that are unique and special that we do here at KRMC that maybe aren't necessarily at other hospitals?
Well, you know, a lot of pediatric therapy departments will have all three disciplines.
Okay.
The big thing that we do is we do a whole body approach. So, you know, me as a physical therapist, I'm not only looking at the legs or, you know, only looking at the trunk. I'm looking at the whole body. You know,
Okay.
how is the trunk weakness of the child affecting, you know, how they're talking as well, you know, because
Okay.
that can be an effect. And, you know, maybe for one child who has some kind of speech impediment, but also has trouble with walking or with core strength, I might give the speech therapist ideas like, okay, if you work on them in this position, it gets their trunk engaged more, and so, you know, they may have better ability to work
with
on their
it.
speech.
Okay.
And vice versa, they'll give me different ideas, like we're
So it's a
working
whole
on.
team approach.
Oh, definitely.
Yeah.
You know, we are constantly talking amongst each other about
Great.
different kids and, okay, what's working for you, what's not working for
Uh-huh.
you, you know, how can I help with, you know, speech or whatnot, what is he working on that I can encourage as well.
That's
And
good. And you're all in the same area?
We are,
Okay,
yep.
so
We're
that
all in the
helps
same
too,
clinic, yep.
obviously.
You know, there's sometimes too that we'll get, you know, if myself and our occupational therapist are working with two children who are working on similar things, we might do, you know, more of a group thing, like
To get a more
playing a game
interactive
together, whatever, you know,
Good.
just to make
Uh-huh.
it motivating for
Sure,
them.
and more
so
fun
that makes
too. Like you said earlier, getting that fun into it, so they're going to want
Yeah.
to keep doing it.
Yeah,
If
and all of our
it's-
therapists, you know, have experience with the different sensory integration things like we were talking before, with the vestibular system, or working on vision or tactile. You know, maybe they're oversensitive tactily, and so having like myself as the physical therapist and the speech therapist knowing those things, we can help the occupational therapist working on it in
That's
our
cool.
own therapy.
Yeah, that's great. And like I said, that's a lot more than I even realized that we're able to do.
Yeah.
And that goes on. You don't think about all of those other issues
Yeah.
that are there.
Yeah.
Half years in Kingman, and are you enjoying it and getting
I
settled in?
am, yeah. I like I said before, I love the desert.
Right.
I love the sunsets and the sunrises.
that's
and,
good.
We actually live out in Yucca, which is in
Oh,
between here and Lake Havasu.
right,
And,
okay.
So it's quiet, which we
Yes.
love, and we have some
You get
property out there.
Oh, good. Do you have critters?
We have one dog right now,
Okay.
an English bulldog. She's
Oh, very
a
good.
baby.
Yeah.
Yep.
Very
So
good.
We
So you do like quadding or mountain biking?
no,
or?
not at this point. A little bit of hiking. We've been trying to get into fishing these last few weeks, so
Oh.
that's our new adventure. is
going down to
fishing.
the river.
Down to Lake Havasu because we live in
Yeah,
between. We go to
sure,
Lake Havasu a
yeah.
lot, so we'll be going there.
And you said is it your in-laws that are in Golden Valley? Did I
No,
misunderstand?
my parents live actually out in Valley Vista.
Oh, in Valley Vista. Okay,
Yeah.
they're out by, I'm out in Hackberry, so.
Oh,
I'm
okay.
out-
You're way
I
out
know,
there.
yeah, I know right where Valley Vista is.
Yep.
And then, it's your in-laws that are in Lake Havasu, right?
In Las Vegas.
Okay, sorry. I'm totally
Somewhere
messing
around
that
there.
up. I knew that general area there somewhere, so you're in between. I guess I was thinking when you were talking about Lake Havasu and being in Yucca,
Yeah.
that's kind of in between. But
Yeah.
that's good. And that'll be, this weekend, or one of these weekends in January, they're doing that hot air balloon
Yeah,
festival
we're
in Lake
planning on
Havasu.
going. I'm
That'll be
excited
fun,
about it.
too. Very
Yep,
good.
yep.
Well, what other things, are there things that you wanted to know about Kingman maybe that you haven't figured out yet?
Is there any fishing on this end of?
Well, we've
you
got
go down
Lake
to the river?
Alamo that's going down off of 93 towards Wickiup.
Okay,
You know, there's some other folks that you might want to check with Game and Fish and stuff and going
that's
on.
a good idea.
Now, we've got Kids Day coming up. I don't know, you were here last year for
Oh, yeah,
Kids Day
yep.
on June 2nd, and I'm sure that's a great opportunity for for you too to have a booth there and
Yeah.
get more information. It's on June 2nd this year. And that here again at the Medical Professional Center, I always like to let people know about Kids Day because we give free immunizations.
Yeah.
We do a lot of screenings, free screenings for the kids. And last year I think we had like 890 kids. I always tell people it's a good form of birth control.
There you go.
Anybody thinking about having a family should have to come to Kids Day.
Yeah.
It'll at least make you think twice. Okay?
Yeah, there you go. Yeah, no, I've done it the last 2 years. We've
Okay,
had
good.
a scooter board race in the
Oh,
basketball
good.
gym, and
Fun.
it's been a lot of fun.
Now,
So far.
speaking of screenings, do you do screenings through the pediatric therapy, or you're pretty much when you get the kids, they're already diagnosed and?
Typically, again, sometimes we'll get a child in for like developmental delay or
Okay.
something like that, and they may, again, not have a diagnosis yet. And
Specific,
so
yeah.
sometimes we walk right along with the parents, in that process of finding out what's
to
going
figure it
on. But say the occupational therapist is seeing a child and she thinks, he's having some trouble with balance, or he doesn't seem to be walking quite right. Can you take a look at him to see if he could benefit from physical therapy? And so
Okay.
we'll kind of screen, within the clinic that way, and then at
Okay.
that point, refer out to the doctor
Go back
to see
to the
if,
doctor and say
if they agree. Yeah.
Okay.
But typically, once they're in our office, they've already been through
Okay.
something with the, I always encourage parents to go with your gut, because
Right.
the parents usually, if they think something's wrong, a lot of times, they're right.
Right,
And so
yeah.
sometimes it takes some pushing, because again,
Well, they're with
other
the
people,
child
other people
24/7
might not see it in, a
Right.
short appointment time.
Yeah,
And so,
yeah. Keeping
they're the
notes,
best
too.
advocate
Sure.
for the parents.
Well, and I always think, keeping journals or keeping track
Yeah.
of things so
Yep.
that when you go to the doctor, you're able to show them you have this kind of list, and keeping a list of questions as well always
Right.
helps too. So
Yeah, and we provide, different handouts that have the different motor milestones or different speech milestones and those kinds of things that kids should be reaching at specific
that's good.
ages. And, with the babies, we have the maternity fair coming up too.
right,
And
right.
so we really encourage lots of tummy time for the kids, when they're
Good,
supervised and stuff
right.
like that, because that's really important for their development as well.
super, yeah, because it
Yeah.
starts early, even like when they're still in the tummy, making sure moms take good care of themselves.
Exactly,
That's what we
exactly.
like to focus on with the maternity fair, and then when
Yeah.
they're newborns, like you said, helping them learn what the right processes are to take care of them. So, well, Trish, thank you. It's been great
Yeah,
having you on the
of
show. I've learned a lot. I always do on this program.
Good.
Thank you guys for joining us this week. I hope you'll join us again next week. We'll have a new guest.